For those ladies who have had a hysterectomy or you're about to have one, you might want to keep watching this video because back pain is a very common thing that can happen after a surgery, especially when it's in regards to your abdominal area or your pelvis. My name is Dr. Dawn Andalone. I'm a pelvic floor specialist, women's health physical therapist, and if you haven't noticed already, I film a lot of videos on hysterectomy, aftercare, and recovery because I find there's such a lack of information, especially when it comes to getting back into activity, how to feel better after your surgery, and how to get your muscles to actually support your body in the best way. Well, back pain is very common because those muscles are all connected with your core and with your pelvic floor, that whole area that has undergone a little bit of trauma with the surgery. Now, whether you had a total hysterectomy and you have an abdominal incision, or you had a laparoscopic surgery, or even if they went in through the vaginal area, any type of hysterectomy surgery is going to come with some recovery time and needing to take it slow and have some downtime and rest. If you want to know more about what I had recommended regards to rest or red flags to watch out for, you might want to go back to some of the other videos that I linked below. Now, in regards to hysterectomy recovery, yes, the first 48 hours to 5 days after, you are going to spend a lot of downtime and recovering and resting. What happens with back pain is sometimes people tend to get in a position where they're recovering or they're experiencing some pain or discomfort and their back starts hurting. Well, on top of taking some pain medications to help it, what else can you do that is going to speed up the process so your back actually feels better? Well, the first thing is movement. Now, you want to listen to your body. If you're experiencing any red flags like bleeding or extra pain, yes, you want to give your body that time to rest and repair. Resting in bed and lying down is going to be important. But it comes a time around 7 days or so. If you're not moving around your house, you do want to get up and get a little more motion because it helps the blood flow and circulation to your body to allow it to heal, but also can help your back because your back needs movement, and resting too much can irritate your symptoms and actually cause your muscles to tense up more. Now, in regards to walking, I think it's important too to balance that out with rest as the same amount of getting up and moving around. You're not going to do anything strenuous like do any house chores or anything like that, but think about walking outside on a flat surface and just kind of gradually increasing your step distance every day of doing it. But walking is going to feel better, especially for your back. Another thing is getting down on the floor and doing some basic mobility type exercises. My favorite is more of a cat-cow yoga pose position. It looks like this. So you're on all fours and you want to think of just tucking your tailbone gently underneath you, flexing your spine, and then reversing. You can take a breath with each movement and pause and hold for a second or two, and then drop your navel toward the floor. So you're just getting some gentle movement in your back. Your spine is flexible and it likes to move. And if you've been sitting for a while or resting in bed, everything is going to stiffen up with your joints and your muscles. So doing the cat-cow stretch and mobility exercise a couple times a day and getting up and walking can also be very beneficial. You can also do this type of exercise called a pelvic tilt. So I'm on my back. I'm going to imagine that I'm flattening my back into the mat. You can do this on your bed too. And then just like you were on all fours, you're just rocking your pelvis, and those hip bones you can feel under your fingertips that you're just rocking them back and forth to get a little movement in the pelvic area and that lower back. So nice and gentle. You're not clenching and squeezing too many of your muscles. You're just getting a little gentle movement.
Another thing that I love to recommend, and you will see this in some of my other videos, is working on some deep breathing exercises, because that is going to unlock any unnecessary tension in your lower back. So placing your hands over your belly, you want to take an inhale into your hands. Feel that belly rise with your inhale, and then as you exhale out through your mouth, then your belly is going inward. So we're just going to do that back and forth about 10 times, just nice and gentle. And you want to imagine that you're not tensing your back when you're doing it, but you're allowing those muscles just to let go and kind of settle your tailbone into the mat or into your bed where you're doing it. And you can repeat that 10 times.
So therefore, movement is one of the most important things that I recommend after a surgery, especially when you're not having any major things like extra bleeding, or it can even help with some of the pain relief too, because you're getting that blood flow and circulation and helping the healing process. Now, the second thing I recommend is working on your scar. So whether you have portal sites at your abdominal region, or you have a total hysterectomy scar, when that incision is closed and you've been cleared by your doctor and it's fully healed, there's no extra redness, swelling, or pus or anything that looks abnormal, then you want to gently start doing some scar tissue mobilization. I have a video on this over on this channel, and I'll link that below, because I dive in more to the details of how to do that on yourself, and how to use 2 fingers and massage the area above and below, and even working on the scar too, because those muscles are all connected. Think about your midsection of your body like a corset around your spine. And if you're locked up in the front and your abdominal area is not able to expand fully with breath, or when you use those muscles because of scar tissue restriction, then you will have extra tension and have to use your back more. So scar tissue is one of the most untapped things that people aren't addressing after any kind of abdominal surgery. So even with the small portal sites or a larger incision, it's very important. And I recommend that for women who have had a C-section as well, or any other kind of abdominal surgery. Now, next is using the right muscles for activities. So as you start to do more housework and you're starting to move around a little bit more, getting back into your activities, and if you start experiencing back pain at that point, then it probably means your muscles haven't been trained correctly and you're not using the right muscles, like your pelvic floor, that area in your vaginal area that supports your bladder, and also where you had the surgery that needs to recover. And also, are you using your core muscles the right way? Well, your pelvic floor is that bottom part of your core. Your diaphragm, your breathing muscles right here are at the top, and then your abdominal muscles are in front and your back muscles are behind. That whole system needs to work together properly. So if you're bending over and you're lifting something like even a grocery bag or a gallon of milk, you want to make sure that you're drawing in those muscles, and think of hugging your belly button in, just hugging it slightly in toward your spine. You're just doing a little lift of the pelvic floor and a little pulling in of the abdominals. And you can practice this as an exercise, but if you imagine that as you're doing the activity or right before you go to lift something, you're going to protect your back. And I see too many times people, they almost like brace their muscles, or they're afraid it's gonna hurt, or they bend over without even thinking about it, like they're twisting and bending and lifting at the same time. I've seen that before too, when they're trying to get something out of the car. Well, when you're not being purposeful after an area that needs to heal, then the muscles around there, or even the joints in the spine, or even your discs in your back, can get irritated and get injured. So training your muscles appropriately through your core and your pelvic floor and doing the right restorative exercises is so helpful. And this is for anyone after any kind of surgery through your abdominal area or pelvic area. Now, I have a program specifically for hysterectomy recovery that does take you through step-by-step how to train your core and pelvic floor in a safer manner and how to recover from that surgery even better. So I will link to that below as well. But I want to show you how I would train the beginning parts of just getting your brain to think about those muscles, to use them properly, because then it's going to become second nature when you go to lift that heavy grocery bag, or you go to pull something out of the car so you don't injure yourself or even exacerbate back pain that's already there. So if, like I showed before, you would do those little pelvic tilt exercises, about 10 of those, and then after the pelvic tilts back and forth, then we're going to imagine just a little pulling in and up from your pelvic floor muscles, which means imagine your vaginal opening, and if you're trying to squeeze and close that, about 50% of your pressure, so it's not just like you're clenching everything, no, because I see people try to tense all their muscles. You're just imagining if you had a marble right at your vaginal opening, you're trying to lift it in and up, and just enough that you feel a little tension of your lower belly as well. So I like to put my fingertips right over my lower pelvis, and as I pull those muscles in and up, I'm gonna still breathe at the same time. So I inhale and I let them all go, and then I exhale and I'm pulling them up with my exhale. Practice this. It's not easy to do, especially after a surgery, so it takes some brain training to really connect to your muscles again, and that's where I like to teach, because going from there and going back to the basics after you have a surgery, it's like you need to break down the movement again so your brain catches on, and therefore your daily activities are not going to cause you any pain or major discomfort. Now, having back pain is a big red flag that something in your core system is not working properly. So I would highly recommend training those muscles for more therapeutic and restorative type of exercises as well. Sometimes doing online videos for Pilates and yoga is not the right thing, but instead getting guidance from someone that is an expert in pelvic floor therapy and knowing how to train those muscles appropriately before you get into more strenuous exercise. Now, I hope you found this helpful. I know a lot of women do deal with having back pain or experiencing bladder leakage or incontinence. I want to guide you in the best direction after you've had a surgery, so therefore you have these tools and know what to refer to and what things can start helping you. So I'll link below some other videos that could be helpful for you, and also my restorative exercise program that helps after a hysterectomy. Thanks so much for watching. Hope this video was helpful. And if you haven't already, please hit that subscribe button. That way you'll get notified every time we release new videos, and I have videos to help you, guide you during this recovery time for your hysterectomy. Thank you and have a great day.